Thank you, Daniel. Yes. So good morning, good afternoon, everyone again, and welcome to the second panel session. In this session, we are going to focus on the purpose of the national strategic plans, the importance of these plans, and how NSPs are actually utilized in countries. We have invited to provide comments 4 colleagues who belong to different stakeholders. So we have a colleague from WHO, Christian Gunneberg, a colleague who is a national TB program manager from Indonesia, Dr. Imran Pambudi, then Loren Mugambi Nyaboga, who represents, in a way, an NGO and the non-state sector in Kenya, and then a fund portfolio manager in charge of Uganda, Saman Zamani. So thank you for being available to provide comments. We have identified a few questions about the utilization of NSP. The first one, how can we ensure that the NSPs meet the needs of and are usable, utilized by all stakeholders? And then among the stakeholders, who needs what and what can be realistically be included? Another question, how do we translate the NSP into action at all levels, so that it's not just a document produced and eventually filed without being utilized? So what possible additional components, if any, should be included in the National Strategic Plan toolkit that we are planning to update as WHO? And are there any components that we don't need or need in a different format? And finally, a question that is very much related to the situation of the pandemic we are still experiencing. How do we make the NSPs work when things suddenly change, like especially now in the COVID-19 context? But I would say in any situation where the access to the health services may be disrupted locally or at the national level. So I would like to open the comments by giving the floor to my colleague, Christian Gunneberg from WHO. I forgot to introduce myself, by the way. I'm Giuliano Gargioni from the Global TB Program of WHO, and I now welcome Christian to give his comment.
Myself. Can you hear me?
Very well, Christian.
That's right. Thank you. So I just wanted, we've been having a discussion about ownership of NSPs and ownership of data. And basically, it's very, very important that the NSP and the data is owned by the people who are responsible for producing it. So it's very important for an NSP to be grounded in the NTP, led by the NTP, not only for the actual development of the NSP, but also for the planning before, during, and after. Because what we were discussing earlier was that the data that is produced in the surveys and in the, let's say also in the reviews and so on that inform the NSP, these are all need to be developed at country level, need to be owned by the country, and everyone needs to be understanding what has been the areas that have been identified as priorities and why they have been identified as priorities, and then moving forward with that during the actual writing of the NSP. That needs to be an inclusive process. Again, there are countries where an NSP doesn't mean anything if the provinces are not engaged. I'm thinking for a country the size of Pakistan. So it's also important that you make sure during the development of NSP that you're very inclusive also with the sub-national level, but also with your partners and everyone who's engaged with it. And then the issue about utilizing the NSP, I think there is a real problem for NSPs, because what we find particularly in TB is that the funding of NSPs and the whole processes are very often supported by the Global Fund, who have a great interest in having NSP-based NSP processes inform their funding requests. And that's been from the very beginning of the Global Fund. And so there's always been a desire to have something to do with the NSP and have a strong NSP in the background. The problem is the timing, which is that very often by making an NSP fit in with the timing of the Global Fund, or then truncating an NSP in order to make it usable as a Global Fund document, it then doesn't fit in with the planning cycle of the countries and the other diseases. And we were discussing in the previous section that it can actually be quite difficult then to actually link in with all the other actors in the health system and plan at the same rate as with them. So that is a problem for NSPs and for the utilization. So the problem that we have for the NSPs is that there are multiple purposes for it. So for instance, NSPs for TB particularly have been used for fundraising efforts. And that of course is also where the Global Fund comes in. But also, of course, NSPs are documents, 5-year documents, where you monitor your progress against the global strategies, where you monitor your progress at country level and develop your work plans based on that NSP. So I think it's important that in our toolkit, we somehow develop the mechanisms that allow the NSPs to be utilized as funding documents, but also that there are processes for implementation of NSPs where we say how the country can actually utilize the NSP in monitoring the progress against their objectives. And then, of course, there is that other issue, which is what happens during a catastrophe, or when things go badly wrong, like with COVID, and how do you change and how do you adapt an NSP for that? And I think the countries are already always forced into that through the Global Fund mechanisms, because they have to do their NSP development and then they have to adjust it again for the Global Fund application. So countries are able to develop extracts from the NSP for these purposes, or to make updates and adjustments. So I think actually we are not too bad at that, but again, it's something that perhaps we should formalize also in our guidance to countries for the toolkit. We have, of course, already we have an emergency planning component in an NSP. So what to do in an emergency, but that doesn't include then updating the NSP itself, if I'm not mistaken. So I think, again, that is something we need to think about. Thanks.
Giuliano, you're on mute.
You are right. So we now move to the perspective of the management of the National TB Program, and I'm asking Imran Pambudi to provide his comments.
Yeah, thank you, Giuliano. So good morning, good afternoon, and good evening from Indonesia. So if you ask me about how to ensure the NSP meet to the needs of the stakeholders, so I think the most important is we should involve all of the stakeholders from the beginning. Because if they are not involved in the beginning, so the sense of the belonging from all of stakeholders is very low. So I think the most important is we should put everyone on the list. The one who have influence to the TB program. And the other things is in Indonesia for the NSP 2021-2024. So we start the meeting or the preparation since September 2019. So we did the review in the September, and then after that we have almost around maybe 6 meetings before the consensus meeting, the big consensus meeting. So it means that we try to have the preparation, and we discuss in the small groups with the several components and also with the writing team, and to make sure that all the items is not put in the NSP. And in the consensus meeting in January 2020, we invite around 220 people from all of the stakeholders in that meeting. So that is the process. And since Indonesia is the decentralized, health is decentralized, so we also need the participation or thoughts from the district and the province, because even though we have national strategic plan, but the district don't want to implement, it's useless. So we have to ask them also. And from the second points that you raised the issue, Yulano, so I think how we translate NSP into action at all levels. So like Christian mentioned, the aim to develop the NSP is we have the sufficient resources. So we can advocate to give the advocation to the president, to the parent, how much money do we need for the TB program. So about this one, we have two ways. First, we translate the NSP into Global Fund proposals. Yeah, and thank God that Indonesia is selected to NSP-based proposals. And the second, we already asked the president to be more focused in the TB programs, and it works. And presidents attend to our ceremony, the launching of TB elimination movement in January. And then the President Jokowi mentioned that he wants to sign a president's decree about TB elimination. So nowadays, our draft is already finished, and we give it to the president's office and waiting for the sign. So in this draft, mostly in the draft of the presidential decree is about NSP. So the NSP will translate to the presidential decree. So we have the strong one. And about the third issue, about what the possible additional components from the tools, I think there is two kind of components that we need to improve. One is about the costing, because in the tools, the costing is separate from the NSP, original NSP tools. And the second is about the mitigation. Like Christian mentioned, we should prepare for the worst scenario, like the COVID. So how we deal with the worst scenario about TB program. So we need to think about that kind of situation during the the right thing for the development of the NSP. And the last things that you want to ask about how NSP works when things suddenly change. So, for example, about how TB program can adapt with the COVID. So in Indonesia, we have adjustment. So we realized that we cannot compete with the COVID issue. So what we do is we streamline the TB, what we call TB campaign, yeah, with the COVID. Because if we do it solely only on TB, it's people in Indonesia now, and maybe in the world, is now they are focused on COVID. So we want to streamline the issue, TB and the COVID. And the second, we already make the protocol about how TB program implement during the the COVID pandemic. And in Indonesia, I think this protocol, TB protocol, is the first protocol in Indonesia. It means that TB is what we call one step ahead from the another program. And at last, I think we need to adjust the target, because nowadays our notification dropped 50%. So it means that in the 2019, we have around 67%. So now in 2020, maybe we can only reach around 40 or 42%. So it's dropped around 50%. So I think that's all the thoughts from Indonesia. Giordano. So thanks. Thank you. Get back to you.
Thank you very much, Imran, for your comments, but also thank you for having given us a glimpse of the complexity of the management of a national TB program that go much beyond the technical competence, I would say. Thank you for that. And now I'm giving the floor to Lorraine Mugambi Nyaboga, who works for an NGO in Kenya. In many countries, the non-state sector plays a decisive role when it comes to the implementation of national strategic plans, because of complementary actions to the ones of the national TB program, and because sometimes, because of their own mission, they choose to work in remote or disadvantaged areas of the countries. So the recognition of the role of the non-state sector within the national strategic plans is key to a successful collaboration with all the stakeholders on the ground. Lorraine, the floor is yours. But you are muted now, like me.
Apologies. Thank you very much, Giuliani. So to begin with, I think in response to the first question that asks, how can we ensure NSPs meet the needs of and are utilized by all stakeholders? And then also, how do we ensure that the needs of those stakeholders are realistically included? I think to begin with, it has to start at the level of engagement of all stakeholders, ensuring that during the development process of that NSP, that at every single milestone, we have that inclusivity of these particular stakeholders. So having an up-to-date review of key stakeholders, at every level, be it at the grassroots level, within communities, representatives of patients, beneficiaries, and even having administrative heads is very important. And then, of course, ensuring that these stakeholders are engaged in the mining of data, which would be useful in supporting or identifying the problems that have to do with programming at different levels. And then, of course, ensuring that there's co-planning, co-creation of strategies so that the needs of all the stakeholders at all levels, particularly looking at the cascade of care and also the larger health system, is addressed. And then lastly, in order to ensure that there's realistic inclusion of the needs that need to be addressed, is ensuring that there's some sort of prioritization of strategies by way of modeling or using data from research and implementation science, so that then it can inform how we prioritize these strategies in light of limited resources. Then looking at how to translate an NSP into action at all levels, I think for me, what I feel is very key is the devolution of an NSP, ensuring that that NSP is disseminated to all the various levels that have been engaged, okay? So one of the things I think we benefited a lot from in Kenya is ensuring that we developed county strategic frameworks. As you know, Kenya is has a devolved health system with 47 counties, ensuring that we developed county strategic frameworks that were aligned to the NSP, but were tweaked to address the specific needs and address the special populations within these administrative units, in this case, the counties. And so once you realize, or once the beneficiaries realize that their needs are well articulated, particularly highlighting the patient and community needs, human rights issues, addressing key population issues, and once administrative heads and regional heads have had those actionable frameworks developed, then it becomes much easier for them to buy in, for sustainability to take place, for them to even align their resources to these frameworks that make a lot of sense for them. Then regarding the NSP, excuse me, toolkit, I think the components that we could look at including, or at least having them in a different format, I think would be looking for some sort of way of supporting countries to, countries to prioritize their budgets. So for example, when you have an NSP, it's pretty aspirational. It has all these many goals, strategic objectives and the like that depend a lot on funding being available to fund that NSP 100%. But it would be even better for that NSP to articulate in a small section, if this NSP was only funded up to say 50%, what should we, in a sense, ensure that we prioritize? So sort of prioritizing the NSP in light of what available resources there are. And then of course, having a plan to disseminate that NSP so that that dissemination does not end at the national level where we can say we have a document, versus ensuring that the actionables from that NSP cascade all the way to the grassroots level. And then lastly, ensuring that there's some sort of standardizing costing, because one of the lessons we learned is that modeling depends a lot on accurate, up-to-date, robust costing. How do we ensure that costing is done in a way that the inputs into that model makes sense and is accurate and is robust enough to be sensitive to the needs of that country? Then looking at how we can change the implementation of an NSP, especially when you have a pandemic like COVID-19, I think the first thing is ensuring that we have a very robust surveillance system that is able to quickly pick up what the data is saying in real time. So with that robust surveillance system, in Kenya, for example, within 1 month of the first case of COVID being recorded, we were able to quickly get information that there was a decline in facility visits, there was some disruption in the TB systems, and that TB cases were declining. So evaluation also of the TB cascade of care so that we identify bottlenecks or weak areas is also pretty important so that we can ensure those are addressed and we maintain that continuity for services. And then of course, engaging the larger health system so that we can quickly pivot and respond to the pandemic while addressing TB through an integrated through integration of TB into the larger health system. Because in countries like Kenya, where in the case of a pandemic, a lot of resources are quickly redirected and aligned to the prevailing pandemic, it's important to ensure that TB doesn't lose focus, and so that we can ensure that mitigation plans can be quickly put in place to address it. So ensuring there's a lot of being open to engage technology in capacity building, programming forums, data reviews, patient reviews, and so forth. Developing standard operating procedures where we know how to address TB in light of a pandemic like COVID. Kenya, for example, developed a TB COVID guideline. And then also implementing things like differentiated care for TB patients so that there's that quick response to what is happening as a result of the pandemic. Thank you very much.
Thank you. Thank you very much, Lorraine. Well, we know, and you also highlighted the importance of the NSP as one of the main strategic and operational documents guiding the operations of the National TB Program. It is a fact that this document has provided the basis also for funding and the support for funding requests to the Global Fund. So the fourth panelist in our session is now Saman Zamani, who works as a fund portfolio manager for Uganda. And we are really looking forward to your view on the NSP. Thank you, Saman.
Thank you, Giuliano, and good day to everyone. Thanks for having me, and I'm happy to share some of the experiences we had working very closely with NTLP colleagues in Uganda and among partners and Global Fund Secretariat. It's a good opportunity to again echo what Christian highlighted about national ownership. Believe us that we haven't coordinated with Christian, but that's a very important point we need to make, that national strategic plan is a national document and should again emphasize and elaborate on national priorities. So the question is not how to make it again fit for many different donors or partners, etc. As long as it is used and useful for the national program of a given country, I think that's a big win for us. So my point is again to how best we can build around that core document as national strategic plan, rather than deviate the national priorities. Again, the good example we have through our work with NTLP, Ministry of Health Uganda, we had the opportunity to attract some technical support through partners and a group of technical colleagues who joined this approach for updating and optimizing a national strategic plan for Uganda. It's an extremely well articulated document. It has many good components, I think useful for the NTLP management and team, and that's how we are happy about. A very positive component we welcomed, and we were sure that it was useful for programming in Uganda was the costing component, and we welcome that addition to NSP. Again, it's very difficult to add so many different section or items into NSP. It remains as a core document directing NTLP for implementing of the program. If you look at the NSP, TB-NSP for Uganda, it's very nicely link up with different national documents. Again, we cannot overpack the NSP with so many other texts or priorities. But one example from Uganda is that when NSP describing very well the biomedical and national priorities for stigmatized population, including prisoner and refugee population in Uganda. It very well links to another national document. It's called Equity Plan, and in that document, it elaborates very well the structural and social interventions countries is progressing on for removing human rights barriers. So this type of linkage between NSP was very welcome and appreciated. And I'm very positive that it was useful for the program in Uganda too. Julian, regarding the last question, that was the big challenge for all of us and our country implementers. COVID was one example, but again, as you highlighted, similar challenges may come along the way. As we communicated before, it's extremely important that we safeguard our gains against diseases, including TB. And the approach we have used was not only helping a program to continue running, but also attracting additional resources so that any adjustment or a specific intervention the countries need to be fully funded. Again, it has been very difficult time for NTP in many different countries. The approach from the Global Fund was to attract additional resources as well as using some of this affecting the budgeted intervention. It's much more difficult to implement it than what I'm saying here, but that's the general approach we have taken. Again, our hope is again to see NSP is closer to implementation of the again interventions and program. So the more it can elaborate on activities well linked with operational or implementation plan, I think that would be excellent approach to continue. Other things I wanted to highlight. No, I think NSP Uganda has been an excellent example of partnership at country level and among ourselves as partner and supporting community to the program. One addition we have been always using at the Global Fund is that when we use NSP as a core document, again, it also attracts other partners or smaller contributors to build around that core document so that we enjoy and benefit more of a synergistic effect of our investment in TB program. That's the message I wanted to share with you. Thanks for the opportunity.
Saman, thank you very, very much. Thank you all the panelists of this second panel session. I think you have given us quite some food for thought, and I think we are ready for the second round of discussion within the breakout groups. Thank you.